Darkness, my old friend, I've come to talk with you again, because a vision softly creeping left its seeds while I was sleeping, and the vision that was planted in my brain still remains within the sound of silence.
Our mental health is our psychological, emotional, and social well-being that impacts every area of our life. Having positive mental health allows us to effectively deal with the daily stresses of life, communicate well, and make healthy decisions, and live life to its fullest. But sometimes this becomes a challenge and impossible to achieve this healthy mental state. Most of the information and experience about mental illness comes from social media, movies, and news. The facts and figures shown here are not always true. One has an intellectual understanding of the same. Patients undergoing issues of mental illness are usually termed as mad and often ousted from society. We asked a group of youngsters about their know-how on mental illness.
Mental illness is a health disorder which affects a person's mood, thinking, and also behavior.
It's not always on the surface like any other kind of disease, that it has very noticeable symptoms.
The incapability of doing certain activities or conducting yourself in a certain way that society would expect you to.
Where you start feeling that there is no one standing for you, there is no one who is listening to you, there is no one who is understanding you, you feel completely deprived, you feel alone. It is just a state of mind.
Could not respond to you a certain way you would understand normal people respond to you.
What is normal to me may or may not be normal to that person.
Small changes in behavior, things like a person who used to follow a routine.
Where I find the person behaving extremely weirdly, I find it very uncomfortable and I don't accept the way they start behaving.
Basically the reactions.
It could be childhood trauma, it could be something
Genetic inclination towards being depressed.
Peer pressure, could be overdose of medicines.
Trauma is one of the biggest reasons.
Some unusual experience that I have had in the past could be one.
What I feel is the biggest source is the societal pressure.
go through a procedure with the doctor.
Just listen to them, simply.
I would take him to a counselor.
Definitely go to a professional.
But they are temporary, they are not a part of your family. The patient only knows, okay, that person might help me, but where is the trust?
If they are going and approaching some doctor, if not, help them approach a doctor who'd help them out, and also understand from the doctor how to help them.
A lot of people try to say that, okay, let's wait it out till the period is over and it's going to be fine in a couple days, it's probably just a low phase in your life. But that's not always true.
If the illness is that serious, I would take him to a counselor, and if I be of some help to him or her, I would definitely give him a lending hand.
However, it is going to take a toll on your mental health as well, so you need to take care of yourself at the same time.
school, society, doctors,
social media,
My university.
I am dealing with a mental patient for the last 25 years.
whatever I've heard, whatever I've read.
Bollywood is a bit meager as compared to providing information regarding mental illness, although we have a few movies like Dear Zindagi by Shah Rukh Khan.
introduced us to this app called Your Dost. So I think that also has a lot of self-help things.
I've interacted with them over radio, so yes, there have been a lot of people I've dealt with who have had serious mental illness.
You cannot throw them out.
Yes, why would I not?
Yes, I would, but
Surely, again, depends on the degree of illness. If that person has to be sent to a hospital, to an asylum, to a rehabilitation center, then I would prefer him or her to be there.
Mental illness doesn't particularly mean that you should be kept aside or away from a certain person. No. Someone could be born without a leg. Is it their fault?
again, depends on the degree of their illness.
I don't know whether I am normal or not. Sometimes I question myself. I am a human, so I have a bubble, I have a limit.
Lack of awareness on mental health has made this subject a taboo in society. People hesitate to ask for help, and also hesitate to seek help for their loved ones.
I have seen people who wouldn't hesitate to shout from one end of the room to the other end in a crowded room, saying that I'm suffering from loose motion or having dysentery. But that same person, if he was about to talk about mental illness, would whisper into someone else.
Wise friends and family in close quarters, with no clinical experience, often comes as help, which makes the case more difficult.
Mental illness is a disease, much like physical illness. Just like you would treat hypertension or diabetes, you'd go to a doctor. Similarly, mental illness you can be treated by going to a psychiatrist. It is with medication, people can lead a normal life with their day-to-day activities. It is not something, it is not a stigma, it is not a taboo, it is a disease like anything else.
The most common mental health issues in our country are recurrent depressive disorder, phobic anxiety disorder, intellectual disability, mood disorder, agoraphobia, autism spectrum disorder, psychotic disorder, neurotic and stress-related disorder, obsessive-compulsive disorder. In the homeless population, the most common diagnoses are schizophrenia and severe bipolar disorder, with psychotic symptoms.
Their interpersonal interactions with the people around them become difficult, become odd, intolerable, irritating, frustrating, all the negatives that you can think of. And that is predominantly what drives people around them to treat a person with mental illness differently. So awareness that this is treatable, awareness that with medications and support it's going to get better, and there's no need to ostracize, alienate. That would be the message to give.
A village for independent and enterprising women, also known as Aview, was conceived in 2010 amidst the lush greens of Bengal.
In India, we really don't take care of the mentally ill, and they are left to languish in psychiatric wards and psychiatric hospitals, and there are no takers for them, and they are always within a closed, confined, and not being able to sort of move out. We should give them an opportunity to live in an unlocked environment, and that's how this unlocked environment system really happened. And it has been really successful over the period of time.
It proposes that an unlocked setting for treatment and rehabilitation is a model that works better than the locked hospital setting.
A lot of the times the family, if they do not have any exposure or awareness to mental illness, do not think that this is an illness but something that the person is doing to purposefully agitate people or purposefully avoid work or avoid hard work or avoid being a productive member in family.
Here at Aview, we have imbibed our sacrosanct mission to rehabilitate mentally ill women in an open rural community setting to replace the model of locked psychiatric wards in hospitals that are selected through a screening method.
Let us join hands, friends, and provide succor to society in a segment which stands in dire need. My congratulations to the entire team which has put together this project, and more strength to their efforts in the future.
This organization Aview, who has been caring and curing people with afflicted by mental diseases who had no one to care for them. They have taken them 50 women from the streets who were mentally disadvantaged and taken them under their wings.
This mental illness, it is curable, and we can provide them any facilities, any treatment, any shelter. They will recover their illness.
Aview, in partnership with Rotary Club, for the last 1.5 years, has regularly provided quality medical support for symptom-free living and envisages in providing a safe environment for the patients to re-establish their self-worth.
Socially, most people still do not accept it as an illness. People who come in direct contact with a person who is mentally ill and live with them or live close to them are the ones that really understand that it is truly a debilitating illness. Otherwise, people do not have that awareness still. I sincerely still believe that.
One of our main focuses is to teach the patients vocational and skill training, thereby letting them have the tools to become enterprising and independent. We support and empower them with skills to independently earn a livelihood. One of the missions of Aview is to build an environment-friendly, self-sustaining, small community in the rural setting. It's been seen that the family and friends do not accept these conditions as long as they are not provoking home, school, and work environments.
My perception is that they have already an inbuilt idea that for whatever reason they are not going to be accepted back. They can accept that this or something after this can be where they can stay, they can live, they can earn, they have what I like is an alternative family style. If they can accept that, then they're happier.
There is a constant pressure to perform in these many places. The acceptance of rehabilitative patients works on these trials. This has to change. One needs to understand perspectives, empathy, and needs to be compassionate.
Where were you when I was burnt and broken? While the days slipped by from my window watching. And where were you when I was hurt and I was helpless? Because the things you said and the things you do surround me. While you were hanging yourself on someone else's burn, dying to believe in what you heard, I was staring straight into the shining sun.